Welcome to all those joining us today. My name is Shelley Hartland, and I'm the Director of Operations and Cultural Transformation at the Legatum Institute. It is my pleasure to welcome you to this webinar to showcase our United States Prosperity Index and preview our county-level analysis for California. At the Legatum Institute, we are committed to creating pathways from poverty to prosperity for individuals, communities, and nations. To achieve this, we produce a number of indexes and data sets to help leaders around the world develop practical solutions to deliver genuine and lasting economic and social well-being. Our United States Prosperity Index is just one of these indexes. Thanks to the generosity of the Helmsley Charitable Trust, the Robert Wood Johnson Foundation, and the Walton Family Foundation, we have drawn on our 13 years of experience measuring prosperity globally to create a holistic and comprehensive analysis of how prosperity is evolving across the 50 states of the Union and Washington, D.C. As part of this program, we have undertaken a detailed county-level analysis for several key states, including California. This work will be published next month, but we are delighted to preview some of our findings with you today. We hope this work will provide an objective means of considering how California might emerge more prosperous from its current health, social, and economic challenges. We've got a great lineup for you today. In addition to our own speakers, we are delighted to be joined by three expert panelists. We have Dr. Mary Pittman, President and Chief Executive of the Public Health Institute, Pete Peterson, Dean of the Davenport Institute at Pepperdine University School of Public Policy, and Dr. Michael Shires, Associate Dean for Strategy and Special Projects and Associate Professor of Public Policy at Pepperdine University. Thank you all for joining us, and we look forward to hearing your reflections on the index, as well as the challenges and opportunities for California as you see them. There's also going to be an opportunity for our panel to take questions, so please use the Q&A function to ask these, ideally including your name, organization, and who your question is directed to. If you have any general comments, please do use the chat function to exchange thoughts and ideas. We do ask that you choose the option of posting comments to both panelists and attendees, as this is a great way to start a conversation with others who are also in attendance. Finally, you can find our index data along with our current report and state profiles on our website, www.usprosperity.net. I'm now delighted to welcome our Director of Policy, Dr. Stephen Brien, to provide an introduction to the United States Prosperity Index.
Thank you, Shelley, and good morning to all of you. It's a real privilege and pleasure to be here this morning to share with you our work on the United States Prosperity Index and to give you a little bit of background to how this has come about and what we mean by prosperity. So let's start with prosperity and what do we mean by it and why are we bringing this idea into the debate? Well, our sense has been for some time now that the public debate has been very focused on very narrow metrics around economic well-being, such as GDP per capita or unemployment. And while these are clearly very, very important issues, they fail to capture the broader sense of both economic and social well-being that allows us to have an environment where people can reach their full potential. So we have, over the last 13 years, set out to define and measure prosperity around the world. And what we look at when we're thinking about prosperity is asking ourselves, are there inclusive societies? So that's much more than just the income, but actually how are societies organized? Are the economies open? So not only are they productive, but can people engage in them freely? And are people empowered to the extent that they've got good health, good education, good living conditions? And it's really that mixture that for us creates prosperity. But at one level, it's all very well to take that as an abstract concept. To make it work and for it to be measurable and trackable, we have to put some tight definitions around what we mean. Now, the next slide shows you in a little bit more detail our definition of prosperity. What do we mean? So you'll see the three domains in three different colors. Below that, on the next ring out, you see a series of pillars: safety and security, personal freedom, etc., and then elements which are more detailed, policy-focused, definitions and elements. So let me start with inclusive societies. This domain looks at the institutional structures in society, both the formal and the informal ways in which people engage and interact with each other. So, as mentioned, we think about safety and security. What's the level of crime? What types of crime are present? How serious is it? We look at personal freedom, thinking about people's agencies, their civil rights, the level of social tolerance, the degree of discrimination. To what extent are people truly free to express themselves, live their lives as they see fit, without encroaching on others or being encroached by others? Then in governance, we look at how well a state, a nation, society is governed. What's the degree of political accountability? How well run is the rule of law? To what extent is there government integrity, or is there a lot of government corruption? So this captures the power relationships within society. And then the final aspect of inclusive society is the social capital, which is much more about the bonds that connect us, the sort of glue within society, looking at the quality of family relationships, degree of social networks, where we look at the trust between friends and with strangers. And then also institutional trust, the confidence in public bodies such as the police, the government, the courts, the media. Then the second domain, open economies, captures the robustness of the economic engine across a number of pillars. So the business environment looks at the rules and regulations that determine what it takes to start, to grow, to develop a business, from the labor market rules, access to finance, occupational licensing, all these issues that are that careful balance between providing regulation to protect people, but also not so much regulation as to stymie growth. Then we look at the quality infrastructure and market access, real sort of fundamental issues about the quality of transport, the level of communications. Is there a 5G network, a 4G network available? What about resources? Is there adequate supply of reliable electricity and water, for example, for farming or for manufacturing? Then the last part of open economies, economic quality, looks at the outcomes. Is there a high level of labor force engagement? Is the resulting economic system productive and competitive? And how sound is the state's fiscal setup? Are there unfunded pension liabilities? Is there a large amount of debt that could come back and cause problems later on? So that's the open economy domain. And finally, empowered people. This is where we capture the lived experience, people's social well-being with respect to their living conditions, their health, where we look not only at behavioral risk factors, but also the quality of the care system, to the underlying physical and mental health of people. Education, we look at the quality and participation at all stages of education, right the way from pre-primary, pre-K, through to the skills of the adult labour market. And then finally, and by no means least, natural environment. What's the quality of the environment in which we have inherited, which we are stewarding, custodian, and passing on to the next generation in terms of emissions, air pollution, quality of the land, quality of water, etc. And that for us effectively captures a holistic view of what a prosperous society entails. The elements, these 45, 48 elements, are very specific, measured components such as violent crime or institutional trust, or secondary or tertiary education. And by measuring these in a consistent way across the same set of dimensions, whether it be states or counties or nations, we're able to start to compare and contrast them and understand the relationships between them in a way that other measures make that a lot more difficult. And that's really the power of this index, not only to be able to rank order, to measure communities, but also to really start to understand the patterns behind these relationships, so that we can start to see how important good institutions are with respect to not only the economic frameworks, but also how those institutions mediate the use of resources and wealth to make sure that people benefit from them. So in that spirit, we've been tracking prosperity for the last 13 years. And when we look at the United States, what we see is, unsurprisingly, being the world's economic powerhouse, it ranks fourth globally on the open economies domain. Very, very strong performance. And of course, that's what a lot of the focus in the debate's about. But when we broaden the perspective and ask ourselves, how does the United States fare when we think about all those pillars of prosperity we've just described? We then see in our global index that the United States ranks only 18th. It's still a good performance, but it's not the fourth that it ranks on the economic domain. And the reason for that is that in other areas, such as in safety and security or in health, performance is in the mid-50s, and in living conditions, again, not the strongest. Now, you may ask yourself, what's going on there? Well, I think on safety and security, levels of violent crime are a very natural and sort of well understood one. In health, what we're seeing is it's the unevenness of performance. It's not that the United States doesn't have fantastic health facilities, brilliant world-renowned clinics, excellent, groundbreaking pharmaceutical companies. But the system itself, when looked in the round, is not providing healthcare at a good enough quality for enough people for the United States to be ranked highly in health, unlike other countries. And likewise, in terms of living conditions, there are still many pockets of poverty that are more uneven than, again, would be in other countries. And for us, then, this question really was, this term unevenness keeps coming up in our analysis of the United States. And we felt, well, probably the best way to look at this is to say, let's look at each state as being a unit of analysis, because each state is still a fairly big polity, and there's a great richness of data. So what we decided we would do is we'd produce a United States Prosperity Index. And when we went out and looked at what was already available a few years ago, what we saw was county health rankings, for example, in health. So there was good health level data at granular level. What we saw was there was a freedom of the 50 states. There were various dimensions of this that were captured, but nothing holistic. So therefore, we set out 2 years ago to produce a United States Prosperity Index, taking the core structure that I've just discussed around inclusive societies, open economies, empowered people, and say, okay, for each of the 50 states plus DC, what's the picture we see? And how does that vary? And what are the underlying patterns we're seeing? And can we start to capture some of that unevenness and know which states are strong and how, which states are less so, and what are the areas of opportunity for them to improve? Now, Shaun in a minute will take you through some of the detail of California. But before that, I'd like to share with you a short video that presents the key highlights of our United States Prosperity Index.
The Legatum Prosperity Index shows that prior to the COVID-19 pandemic, overall prosperity in the US had been rising for the past decade, although long-standing challenges mean that prosperity was not experienced equally by all Americans. Although the country was ranked high for economic pillars, it was falling behind in living conditions, health, and safety and security. Our U.S. Prosperity Index shows that the country's economic quality had improved as unemployment had fallen after the financial crisis. This meant it was in a strong position before the virus hit, but of course that strength is now at risk. Improvements in education and living conditions had also been significant in driving the growth and prosperity over the past 10 years. Although education had been improving, school closures as a result of lockdown measures put the progress made on educational outcomes at risk. More positively, one area of living conditions that had improved significantly over the last decade was connectedness, with access to broadband rising in both rural and urban areas, enabling greater connectivity during lockdown. Health in America had improved over the first 8 years of the past decade, so the country was in a good position to deal with the impact of the pandemic. However, the mental health of Americans had already been declining even before the coronavirus crisis. There had been large increases in drug overdose deaths, rates of suicide, and levels of serious mental illness across all regions, with 48 states seeing mental health decline over the past decade. Deteriorating social capital was also impeding further prosperity. While personal and family relationships had strengthened, social networks, institutional trust, and civic and social participation had all deteriorated. The fact that only 11 states had seen an improvement in social capital since 2009 is a real concern, given strong communities are the cornerstones of society, and the decline in other states is indicative of societies that were already coming apart rather than drawing together. Despite these national challenges, the US Prosperity Index shows that before 2020, prosperity had improved in 47 of the 50 states, plus Washington, D.C., providing a strong foundation on which to build a recovery as the country emerges from these challenging times. But while all but 4 states had seen prosperity improve, no single state has yet succeeded in fostering a high degree of both economic and social well-being for its entire population. Other than top-ranked Massachusetts, no state ranked above 20th in all 11 pillars of prosperity. Now more than ever, it is vital that all states seize the opportunities to learn from each other, to increase their prosperity, and share their experiences with one another to help them improve.
I now invite Shaun Flanagan, the director of our Centre for Metrics, to unpack the index in more detail.
Thanks very much, Shelley, and good morning, everybody. It's great to be with you today. Before I talk through some of the findings for California, I just wanted to build upon a little bit what Stephen was saying earlier around the United States Prosperity Index. So in developing the index, we took our global taxonomy and then applied it at the state level. And we did this drawing upon the expertise of 40 US experts. So these were experts in health, education, across the 11 pillars of prosperity. And they really helped us devise the taxonomy that was most applicable to the US, but then also helped us select and choose the most appropriate data sets to use in measuring the different aspects of the index. So we just want to say a big thank you to them. I think some of those are on the webinar today, and we're very grateful for their help and support. So when we look at how prosperity is distributed across the 50 states of the Union and DC, what we see on the left-hand side here is a map of the US showing the latest year's worth of prosperity. And you'll clearly see a north-south divide, which probably doesn't come as a particular surprise. But we see that 8 of the 10 weakest performing states are located in the south. Whilst a number of the top performing states are in the northeast, they don't have a complete monopoly on top performers. We also see that Colorado, Utah, Minnesota, and Washington State also rank within the top 10. So what does the index tell us about California? So when we look across the different pillars of prosperity, overall we see that California currently ranks 24th, which is broadly in the middle of the rankings, but it performs very differently depending on which pillar you're considering. So if we look at health, it's 4th, economic quality, understandably, given it's the biggest economic state in the US is 6th. But then across other pillars, it ranges all the way up to 43 for market access and in infrastructure, and 44 for social capital. But then when we look at how prosperity has changed across the state over the past decade, you see on the top left here, a chart that just shows the change in prosperity score relative to the US average. And you'll see that California has a particularly strong performance over this time period. And in fact, it's outperformed the US as a whole in its performance. And after Washington, DC, it's the second most improved state over this time period, and has consequently moved from 32nd in the rankings to 24th. And then on the right-hand side, you can see what has driven that improvement. In all but one pillar, social capital, it's seen an improvement. So economic quality driving a lot of the growth, but also improvement in governance, but also in education, health, and the natural environment. So what I want to do now is just spend a little bit of time walking you through almost 2 case studies, as it were, for California. One is where there is a particular strength, and drawing upon this idea that you saw in the video, perhaps around states collaborating and sharing and learning from each other. I want to just show you an example where California performs particularly well through the index, and where is another state that could benefit from that sort of strength. And then talk through an area of perhaps weakness where another state could benefit, or California could learn from that state. So if we take health, for example, overall, this is California's best ranking pillar. It ranks 4th and has moved up 3 places in the ranking over the past decade. And then what you see here is those elements, 6 elements that make up health: behavioural risk factors, preventative interventions, care systems, mental health, physical health, and longevity. And you see across 4 of these, it performs particularly well, ranking in the top 5. The 2 where it does less well around preventative interventions and care systems, this could potentially be an area of concern as the state headed into the pandemic. So care systems, looking at the strength of the system around healthcare coverage for the population, where has medical care been avoided due to cost? And on preventive interventions, this is around the sort of access to the medical services and the extent to which those services are also accessed. So that perhaps is a little bit area of concern, but let's just consider mental health, for which California ranks first of all the states and has moved up 7 places in the rankings. If we look at the indicators that underpin that particular element, it's made up of these 5 indicators. So suicide rate, drug overdose death rate, serious mental illness, disability weighted prevalence from mental illness, and a self-reported measure of mental health being not good. Again, you'll see that California, all of these indicators performs well. It's within the top 10. So it's a strong performance. But let's compare and contrast with another state perhaps that doesn't do quite so well. And if we consider Oregon, so where we see California ranking first for mental health, we see that Oregon ranks 35th. And when we compare and contrast the indicators, we can see across all of the indicators that Oregon underperforms compared to California around the suicide rates and drug overdose death rate, but also the extent of serious mental illness, self-reported mental health not being good, and the disability weighted prevalence of mental illness. So what is it that California is doing around mental health that could perhaps benefit Oregon? What initiatives or services are being provided that Oregon could learn and benefit from? And this obviously is something that's a particular concern at this moment in time as we go through the pandemic, as people are concerned about their jobs, about their welfare, but also just general anxiety around the pandemic that creates, very likely to impact mental health. So what is it that Oregon could learn perhaps from California to help its residents? So if we take another example, if we consider education, for example, we've got here the 5 different elements that make up education. Overall, California ranks 38th for education. It's not a surprise to you on tertiary education that California ranks so well. It's 12th overall. It has some of the strongest universities, world-renowned universities alongside DC within the state, so therefore it ranks 12th as a strong performer. But when we look across the other sorts of stages of education, the K-12, around primary and secondary education, we see that it's a not such a strong performance. And I just want to have a look at the primary education, the sort of early years K-12, as it were. If we look at the indicators that underpin that, we can see that whilst enrollment is high at 96%, we see across the test scores at grade 4 in maths, science, and reading that actually California doesn't perform as well. And in fact, on science, it's the weakest ranking state at 51. So if we compare and contrast with another state that is performing more strongly on this, if we look at Washington State, we see here that whilst primary education is 47th for California, it is 19th for Washington State. And when we compare and contrast the indicators underpinning that, we'll see that whilst California does have a slightly higher enrollment rate for this stage of education, we see across all the different subjects that it underperforms compared to Washington State. And again, what is it about the education system in Washington State, perhaps, that California could learn and benefit from in order to try and improve its test scores at this particular stage, but also secondary education, around how could it look to other states to see how it could strengthen there. And then it could offer, a strong education provision to its pupils throughout their entire sort of education from early stage education all the way through to university. I should imagine that with some of the universities, it's difficult perhaps for some of the pupils within the state to compete with those from coming outside the state, given that the actual education is not as strong perhaps in other states, and therefore puts pupils at maybe an unfair disadvantage in competing for these places. So That there hopefully just gives you a little bit of a flavour of how the state level index can be used to highlight strengths and weaknesses and where states could learn and share with each other in terms of identifying strong and weak performance and what might identify best practice. I just wanted to conclude by talking you through a little bit on the county analysis, focusing on 8 states. So we've done this analysis over the past year. We recognise that a number of the states are very large and actually contain huge disparities within them. If we look at the likes of California and Texas, they are very, very large states. So what we wanted to try and understand a little bit more is how is prosperity shared across those states? So we've done a deep dive. Ideally, we would have liked to have covered all of the states, all of the counties across all states, but all 3,000 plus of them would have been very challenging. So we've selected these 8 based on sort of good geographical, but also demographic coverage, representation, and also where selected a number of states that rank at different stages within the state level index. So some from the top, some from the middle, and some towards the bottom. So we have New York, Georgia, Iowa, Oklahoma, Texas, Colorado, Montana, and California. And in constructing the county level index, what we've wanted to do is mirror the state level index so that these two can be used hand in hand to really understand how prosperity is shared within a state. So we have 215 indicators, 132 of which have some degree of county variation, either at county level or perhaps metropolitan statistic area level. But there are 83 that are statewide, and some of these 83 will be relevant to each county. So if this is around state laws that are set, or perhaps state occupational licensing, they will be equally relevant to each county. But there are some in those 83 where we would have liked to have got county variation, but the data just simply doesn't exist. So for those, we have used the state average, which allows us to compare and contrast across the states at county level. What you see here is how prosperity translates across these counties, 829 counties in all, and they've been grouped into quintiles. And immediately you'll see that some states are very homogeneous in how prosperity is distributed within them. So the likes of Iowa and Colorado, whereas you'll see in other states there is considerable variation across the state in terms of how prosperity is manifest. California, for example. So if we just spend a few minutes having a look at California, we see here on the left-hand side those counties that are strongest within the state, and then on the right, the weakest, that those that are at the bottom perform less strongly. So obviously no surprise that you'll see that those counties around the Bay Area and the Los Angeles area are the strongest performing counties. But you also see the coasts, the counties on the coast in between those two areas also perform well. And there is a band that sort of stretches across through Sacramento. But when we look at how that plays out across the 3 domains, we do see a diverging or a different picture. So looking at inclusive societies, we see here that there is again a mixed performance, and actually no county within the state ranks in the top quintile. Kern County is the only county in the bottom quintile, and that is due to a particularly weak performance on social capital. On open economies, the map in the middle towards the bottom, again, not a surprise that counties in and around the Bay Area and Los Angeles area rank in the top quintile. But the counties in the north all nearly appear in the bottom quintile of the index. And then finally, on empowered people, we see again that along the coast, counties perform particularly well, but also those that border Nevada. I just wanted to conclude the analysis by just talking you through some analysis that we've done in the report, which Shelley mentioned earlier is being published next month. So further details will be in the report. But what we've realized, and one of the things we wanted to do, is look at how counties compare across states rather than just within a state. So how do they cluster together in terms of sharing similar characteristics of prosperity? And in the report, we look at archetypes of urban prosperity and archetypes of rural prosperity. And when we look at urban prosperity, there are sort of 3 clusters that emerge. We have the metropolitan core, the large southern cities, and the small southern cities. And a large number of counties within California rank within the metropolitan core. These are not all urban areas. Some rural counties also appear in here, but they share more similar characteristics to their urban counterparts. And what we see for the metropolitan core is that overall they outperform in terms of overall prosperity, the actual average for the 8 states. And then when we look at how that translates into comparing across the individual pillars, we see that there is a difference between how the overall 8 states, the counties across all 8 states perform, and those in the metropolitan core. So on personal freedom and governance, the metropolitan core has a stronger performance, less so on the business environment, marginally better on market access and infrastructure and economic quality, and a higher or a better performance on health and the natural environment. So what does that tell us really around areas of strength and areas for improvement? Well, we know that these, from the analysis, that these areas have strong economic infrastructure. There are high levels of social tolerance. There are good levels of governance and a healthy population. But around areas for improvement, things that these areas could look to strengthen are around business regulations, already talked through K-12 education, reducing crime, and also providing greater access to affordable housing. So that sort of concludes the insights that I wanted to share with you today, just giving some examples of how the state and county level indexes can be used to address local challenges. I do hope you found it helpful and informative. And in conclusion, really, our sort of call to action is that state and county leaders, policymakers, and others will use these indexes to create data-driven policies that address local challenges and that will improve the prosperity for all Americans. As Shelley mentioned, all of this information is open source. It's all available via our website at www.prosperity.net. So please visit there. There is a state profile for all 50 states and DC giving you full information. So thank you very much for listening. I will now hand back to Shelley.
Thank you, Shaun. Thanks so much for that. That was super helpful. Please do keep sending through your questions as well. I mentioned at the start, you can use the Q&A function on Zoom, and do send through your comments on the chat function too. There are clearly a number of challenges ahead, especially due to the health and economic consequences of the COVID pandemic. However, there are also huge opportunities for California to emerge more prosperous from this. To discuss some of those challenges and opportunities, I'll now turn to our expert panelists to offer their thoughts. Firstly, if I could go to Dr. Pittman. As President and Chief Executive of the Public Health Institute, you're acutely aware of the health challenges California was already facing. We are currently living through a major health crisis, and the index shows that mental health in particular is on a steep downward trend across the state. What do you think are the particular challenges, and how can we make sure California emerges with strength from the coronavirus pandemic?
Thank you very much for inviting me to join your group today. I have been a strong proponent and very keen on indicators my entire career, and let me say how impressive the work of Legatum Institute, and particularly the indicators that you shared with us today, are, and I think are going to be incredibly useful to people who are doing work in improving health and prosperity in the United States. To answer your question, I think it's crucial for us to understand the context of the multi-sector, multidisciplinary work that is going on across the US, and particularly is very robust in California. And one of the reasons that I want to focus on that is that these partnerships are utilizing these indicators to help guide their work. They focus on integrated health, they focus on prosperity and well-being policies and programs. And many of them have been forming across hospitals and health systems, public health, community development, which has been relatively new in the past decade, and other sectors to find new and innovative ways to invest in prevention and in the social determinants of health. to improve the health status and well-being of everyone in the population. And these partnerships have been creatively trying to think about how do we look at community and health needs, including the economic needs of populations. You mentioned the county health rankings. I think that has taken us a long way to put in the hands of individuals who are working at the county level the data that lets them compare themselves with colleagues across their state and across the nation. At the Public Health Institute, our Public Health Alliance of Southern California has developed the Healthy Places Index, which not only identifies indicators across a whole spectrum of different topics similar to Legatum, but they also link policy options connected to each indicator so that when people are working at the local level, they not only can rank themselves, but they can also think about what are some of the solutions that could be at least teed up for consideration. I think we also have to look at the context at the federal level. For more than 4 decades, we've had the Healthy People Indicators for the United States. And this past year, or past 4 years, I was able to serve on the Secretary's Committee for Healthy People 2030. One of the major shifts in that set of indicators is to have an equity frame to really tease out where there are huge disparities across different topics. And they will be launching those indicators August 18th of this year. Another fairly new program is the Wellbeing in the Nation measurement framework. And this has a set of common measures that are taking a look at what are those vital conditions that are necessary, and they can be summed up as the basic needs for health and safety. But interestingly, it also goes beyond clean air, water, and food to look at the sense of safety and belonging, loving relationships, and freedom from toxic stress and mental illness. So taking a look at all of those, and one of the reasons that I've raised these measures and reports is because these indicator sets, I think all have now developed a common set of indicators around what creates health and what we need to be measuring to know how we're doing and the policies that this nation needs to follow to be able to really address well-being and economic prosperity. So going to your question about the decline in mental health, I have to disagree. I think in the U.S. Prosperity Index for California actually shows, while California ranks 4th overall, it has improved over the last 10 years in mental health. And in health overall. So we did slightly better than the national average, but that's not to say that mental health is in the state that we want it to be in California. And in fact, we have a mental health workforce crisis in this state. If you take a look again at the Legatum data, you see that the ratio of mental health workers to population is much lower in California than it is the rest of the nation. What's clear is that health is influenced by every aspect of, where we live and work, and access to affordable housing and safe neighborhoods and good paying jobs are critical. And we do have a major housing problem in California, which I think is contributing to people's feeling of insecurity and stress, which we know stress is related to mental health. But these opportunities also look different based on your color of your skin and the circumstances that you were born into. So as you showed, the demographics are important for us to be following. So I mentioned the following data sets in aggregate to show that there's a pattern of barriers to opportunity for people who have lower incomes, communities of color, and these pattern differences are what we need to be taking a look at. They have developed from unfair policies and programs over decades, and those have contributed to the mental health problems we have in California. And so while we are not showing a steep decline, we still have mental health problems. And so because of time, I'm not going to go any further, but I do want to say that I am optimistic that California will utilize this new set of data that you're bringing out, as well as the other indicator sets, to look at where we need to be disaggregating our data, looking at subpopulations, excuse me, low income, people of color, immigrants, people with disabilities, and focus our investments where they're needed most so that we can have well-being and prosperity for all in California. Let me end there. Thank you.
Thank you so much, Dr. Pittman. That was so insightful. Really appreciate that. I'm next going to turn to our next panelist, Pete Peterson. Pete, you were the Dean of the Davenport Institute at Pepperdine University School of Public Policy, and I know you're passionate about public engagement in state and local government policy making. How might the United States Prosperity Index help those designing innovations and creative solutions so that we can genuinely improve people's lives and create a more inclusive democracy?
Well, thanks so much, Shelley, and great to partner here with the Legatum Institute. This Prosperity Index is extremely important to informing policymakers here in California. As someone who's been involved in the field of civic engagement and participation for the last dozen years here in California, I can say that the data outlined here in the index is very much correlative of much of the data that I've seen here for over a decade in California. I want to focus my remarks on the specific domain of inclusive societies. I love the term that Dr. Brien used before, a very British term, uneven. That is a word that definitely describes California's performance in that sector. And so many areas that California is doing very well in, but others that I want to address toward the end of my remarks that are ones that have been present for many years and ones that policymakers and frankly, across the sectors, nonprofit leaders, as well as the private sector needs to find a way to better engage with. In the inclusive societies domain, that is the one of the three that we perform here in California least well in. It is the lowest ranking for the three domains. But the places where we perform very well are the ones that you would probably guess as a more progressive state here in the United States. Those categories that we do well in are absence of legal discrimination, social toleration, and free speech in public spaces. So the general legal protections for both free speech, employment, broader civic engagement across races, demographic types are certainly in place here in California, and I think it's something that California should be rightly proud of. But when we look at other areas of civic engagement, first in participation, we do much less well. I point out that our 49th ranking in election administration, as determined by MIT's Election Performance Index, has been a ranking that's been fairly consistent for well over a decade. Ironically, for a state well known for its use of technology, California performs very poorly in the area of using technology to both inform voters and to engage voters at the polling place. Somewhat related, although not reflected in the index, is the fact that California depends so deeply and broadly on this weird balance between the use of the ballot initiative as well as elected representation in the formation of statewide public policy. And I think that continues to be an area that the state struggles with. What are the policies that are going to be determined by popular ballot through initiative and referendum, and what are the areas that the state legislature should be better engaged with? And I think that what that has led to over the years and continuing, we certainly see evidence of that in the forthcoming November elections, are the possibilities of radical changes happening in our policy-making processes due to the fact that we're going to see some significant measures on the popular ballot this coming November. We also perform poorly in state government spending transparency, the use of technology, again, ironically, to make and better inform citizens on how state funds are being spent. We rank 49th in the country in using technology to make state government spending more transparent. And then finally, and related, public records request compliance, we are 37th. But where I want to address most of my remarks is in the area of civic and social participation, where we rank 40th overall in that pillar. But when you look at the categories underneath, or the indicators underneath, that's where I think we need to continue to look at ways to improve. We rank 47th in the country in our rate of volunteering, and 40th in being active in the neighborhood. When we look at the pillar of social capital and networks, that's another area where we perform very poorly in. We rank 49th overall nationally in that category. And underneath that, the indicators, we are 49th in doing favors for neighbors, 44th in trusting people in the neighborhood, and 44th in creating supportive neighborhoods for children. So how are we performing, or why are we performing so low in those particular indicators of social capital and social trust? I just want to leave with the research that I've found most compelling in trying to address these issues. The Harvard sociologist Robert Putnam wrote a research study back in 2006, 2007, titled somewhat ironically E Pluribus Unum, in which he looked at levels of what he called civic trust in 40 American cities. And what he found, which was rather, I guess you could say, controversial at the time, was that he found an inverse relationship in levels of ethnic diversity to their levels of civic trust. In other words, in cities where there were higher levels of ethnic diversity, he found lower levels of civic trust. Many of those indicators where we perform so poorly in statewide, he found that in individual cities across the country. And I just wanted to point out that the 4 lowest performing cities in this research study from Putnam were Los Angeles, San Francisco, Oakland, and the lowest scoring city in the entire country, again, showing high levels of ethnic diversity and low levels of civic trust, is Minneapolis, Minnesota. Now, at the time when that study came out, I thought, wow, that's kind of interesting. I've always thought of Minnesota as being a place where you saw great cohesiveness and civic education. But recent events, for those of you who are outside the country, may know that much of the protest and civil unrest that we've seen spread across the country all began with the murder of George Floyd in that very same city of Minneapolis. And many of the places where we've seen here in California high levels of civil unrest happen to be in the cities of Los Angeles, San Francisco, and Oakland. And so this is an area where I think we need to continue to find ways, both, again, across the sectors, government leaders, business leaders, and nonprofit leaders, to find points of connection between, especially in states and cities where there are high levels of ethnic diversity, in order to achieve not only greater levels of civic trust, but frankly, the American dream. And so with that, I'll leave it there and turn it back to you, Shelley.
Thank you, Pete. There's no better thing to finish on than the American dream. Such helpful remarks. And our final expert panelist of today's webinar, Dr. Shires, if I could come to you. Dr. Shires, you have a successful track record of finding new strategies and innovative solutions, especially for small and mid-sized businesses. How do the index's findings on the business environment in California resonate with your own experiences? And what do you think needs to change to increase prosperity?
Well, thank you. And thank you for that question. And thank you for this work. I mean, indices are really powerful tools for bringing lots of questions and issues to the table. One of the challenges is in doing indices is always the weighting. And I'm struck by the diagram of the United States. When you look at the states that people are leaving and moving to, they tend to be going from greener places to redder places. And I think that, people's indices on where they want to spend their lives sometimes reflect a radically different weighting scheme than what we think of in sort of these broad categories. I think that if you look at the prosperity index and you look at the economic pieces, There's some powerful stories there. And, California is kind of in the middle of the pack in this area, and I think that's fair in many ways. But it disguises something that I think Dr. Pittman was talking about, the differences of experiences of Californians. And I mean, if you look at these things, what you see is California buoyed by finance areas, entrepreneurship, dynamism, sort of the creative economy. You see us first in the country, second in the country, when you look at those things. And then when you look at the rest of the economy, you see us lagging. When you look at kind of, we were talking about, you asked about small and middle-sized firms. You look at the areas where they're operating, where there's regulation. Maybe it's manufacturing, maybe it's a service sector. The level of regulation, the level of opportunity for sort of the lower and middle income classes, which is actually one of my one of the areas that I spend a lot of my work on, talking about how you create opportunity in those spaces. There's a big difference there. I mean, California historically was the place where anything was possible. We just have to figure out how to do it. And whether that was Hollywood, whether that was the aerospace industry, whether that was the military sector during the wars, or whether that was tech today. I mean, that's always been the attitude. But that disguises the rest of the economy. If you look at investment, for example, and you see in the investment numbers, entrepreneurship, California is among the top. But what we're not investing in is infrastructure. We're not investing in roads. We're not investing in schools, in buildings, and you see those numbers in those results. And so there's this kind of two aspects to the California economy that we have to figure out how to balance off, I guess. The original theme of this session, we're talking about 2019 when we look at this index. This is before COVID. This is before the social unrest of the last 2 months. As I told a friend of mine, the world we lived in 3 months ago is gone. And when we look at the opportunities going forward, we have to put everything on the table. I mean, California, in some ways, if you look at the economy, has become this sort of progressive dystopia where elite tech companies that are almost completely unregulated and have lots of capital flourish, while the rest of California languishes in an overregulated morass of rules, taxes, and barriers. I mean, if you look at things like domestic market contestability, where California finished last, out of 51, it finished 51st. You look at licensing for low-income occupations, you look for the training cost of getting into those, you look for the time it takes to get certified, you look at regulation density, we're 47th, 49th, or 51st in all of those. California has a massively overregulated system. And if we want to bring this economy back to life, if we want to create opportunities for people, entrepreneurs, especially entrepreneurs of color, and those who've been most negatively impacted by the recent events, we really need to relax those regulations and give everybody a pause from it. I mean, one of the reasons we have a housing crisis is because it's very hard to build in California. So when you add all these things up, I mean, the first step is to deregulate. We have an initiative on the ballot, which is a tax increase, which will affect small and medium-sized businesses by changing the property tax rules. I mean, we need to put those things aside and say, hey, this is a time to actually double down on deregulating so we can kind of jumpstart the economy back to life. And I really think there's a huge opportunity if we do that to slow the migration of people from California to places like Texas and Alabama and Georgia.
Thank you so much for those comments. Thank you all three, for covering different areas, and that was absolutely fantastic. Let's now address some of the questions that all of you attending at home have been sending through. So I'm just going to go through them. So Stephen, if I can come to you firstly, we've had a question from Henry Gascon. How do you reconcile this prosperity index with the Human Development Index? And I would suggest just how do you reconcile this with any other indexes that are out there, especially as well?
Sure, thank you. So the Human Development Index is quite a narrow index designed originally at the United Nations to help do sort of quick sort of sense check across many countries using data that's nearly always available, such as longevity, etc. So it very much focuses on one or two critical dimensions of human well-being. And from that point of view, is a very, very good and easy way of getting a quick ranking, quick sense of progress. One level, we've taken the exact opposite perspective, which is to think about a richer, holistic view that covers a large amount of the domestic policy agenda. And as a result, every aspect of the Human Development Index is within the Prosperity Index, albeit only a component of it. So it's the Prosperity Index deliberately designed to be holistic, and as a result, it takes quite a bit of effort to capture and to manage, etc. The Human Development Index, similar principles, but very much designed to be quite narrow, focused, and in effect easy to measure and easy to interpret. So it's a horses for courses thing, I'd say.
Brilliant. Thank you so much for that, Stephen. Next question from Anne Hissing. If I could just direct this to Shaun, it looks like much of the variation and heterogeneity may be related to income and socioeconomic status. Are these adjusted for?
So what we're trying to capture in the index is a way of comparing and contrasting across the states and across the counties. So we're using a standardized set of indicators that allow us to compare and contrast. Within the index, what we've done is we've included certain measures where certain groups of the population of society are disproportionately affected. So around poverty, but also around affordable housing, around homelessness. So in those particular aspects, we see that we are capturing that within certain areas. But what the index allows us to do is, because it's constructed across states, is to understand how they differ. What I would say is that in using this index, you also need to couple it with local information, qualitative information, to drill down and understand why a certain area is underperforming. Is it because there is a certain prevalence of a certain group that is disproportionately affected? And then that would obviously inform what type of policy response you should make.
Great, thank you so much for that, Shaun. I've just noticed the time. We've only got 3 minutes left, so probably just time for one more question, unfortunately. As everyone on our panel, I'm sure has so much more to say, but do keep chatting in the chat function afterwards. So Stephen, if I could just direct this one back to you finally. From Colette Jordan Bow, prosperity is not universally shared or felt. Are you measuring how wealth and well-being is being experienced by the different demographic groups?
Yes, but not to the extent that we would like to. One of the things that we try and do is sort of focus on geographic differences, the main sort of unit that we look at. And obviously, as we get to more disaggregated spaces such as counties, you're starting to pick up much more of the demographic variation implicitly within individual counties. When we look at the global index, we also do this, for example, around the world. Women's rights, critically important issue everywhere, but in certain regions of the world, that disparity is much greater than would be found, say, in the US. Now, when it comes to the US, we have sought to find demographically disaggregated data. For example, we'd love to see it on employment and underemployment, and in other areas, but that information is not generated and published in a systematic way across all the states and across counties. So we are somewhat hindered by data availability. And I think I have called on the public authorities before, and I will do so again, that when producing and publishing data on socioeconomic matters, not only to publish urban versus rural data, but to publish it by demographic breakdown where you can, because this is the hidden challenge that unless we shine a spotlight on it, we would love to capture more of an index, but in general, if the spotlight doesn't happen, we won't be able to recognize the causes of the problems and then hence also address solutions. So watch this space, and if we can get more information broken down by demography, we will gladly expose it.
Great, thank you so much, Stephen. There's been so many brilliant questions asked on the chat function. Again, just send us your contact details if you want us to pass on questions to any of our panelists. Do get in touch with us, and we'd love to hear from you. And we hope this is the start of a conversation, not the end of one. So just thanks once again to all who submitted questions and comments. Thanks to our speakers and panelists for their thoughts. I hope today's discussion will encourage wider and continued engagement across the US, and especially here in California. As a reminder, you can find more information, including all the raw data sets, at our website, www.usprosperity.net. Today's event has been recorded. A couple of people have been asking and will be available in a few weeks' time. We'll be in touch with details of how to access this recording as soon as it's available. This is just one in a series of webinars we are hosting, with another 2 events being held next week, one focused on Colorado and the other on health. Further details of these events will be posted in the chat function, and we would be delighted if you could join us for these. At the Legatum Institute, we create indexes, publish reports, and host events to help leaders, policymakers, and influencers at every level identify the practical solutions that will deliver real and lasting prosperity. Please make full use of our index and its related resources to help set agendas for growth and development and to create roadmaps to improve institutional, economic, and social well-being for the whole of California and for all Americans. Again, thank you so much for joining us today, and a special thank you to our expert panelists for generously giving of their time and for their insightful perspectives. I hope you have a wonderful rest of your day. Thank you.